Welcome to Mental Health First Aid. We're here today to talk about how do we navigate the mental health services. It's something that can be very complex and very hard to understand, but we're going to talk about some stats and some other interesting information of why you should know this and why you should understand this. We have two people with us here today from Linden Oaks. They're from Utilization Review. One is Cheryl Bates, who's with us, and she is the supervisor. I know your name said super on the computer, so I had to say that. Mm-hmm. And our other one is Emmy Ernstner. It was close. It was close. Utilization Review, and you are considered the coordinator?
Correct.
Right. Excellent. We have lots of things we want to talk about and explain these different things. And when I was thinking about this show, I was trying to say, well, this could be very complex to try to figure out what to go through and how to do this. But looking at it, why should people even think about this now? They don't have an issue. There's no problems going on in their family. Nothing's happening. Are there any reasons why you should start looking a little bit closer at these things? What do you think, Cheryl?
Well, if you think about it, Barry, 1 in 4 of us struggle with a mental illness. And it can go from anywhere from ADHD to mild depression, all the way up to schizophrenia and psychosis. So it's really important to know what those services are out there.
You know, and I guess we talk a little bit further also. You also have some other credentials.
I'm an outpatient therapist, so I do have a private practice in the community. So not just dealing with the insurance in the hospital, I also see clients outside of the hospital.
Okay, so you're a clinician. Mm-hmm. You're a licensed clinician.
Yes.
Emmy?
Same thing. I don't have an outpatient practice, but I do have a degree in clinical psychology.
Is that something you have to have for what you're doing now with Utilization Review? Is that a necessity that you have to have, or is it just something that helps?
It's something that definitely helps. I think more and more with the insurance companies, they may not be requiring that a master's degree clinician do the concurrent reviews and work with them, but it does definitely help.
You know, you said something earlier in the beginning about 1 out of 4 of us. It's not them. It's not.
It's everybody.
It's us. Yeah, and something that we do talk about with mental health first aid, and discuss that with people, that we need to get these things out of the shadows. We need to get them out of the dark holes and be able to talk about them and discuss them with mental health issues. And I think it's a strong term and an understanding term, that 1 out of 4 of us. So it could be family members, could be coworkers, neighbors, friends, across the board.
Could be your child too.
Exactly. So we're looking at, this is an issue that you should know about or understand, because there's probably a pretty good chance you're going to be dealing with it somewhere in your lifetime. And maybe not you personally, but somewhere with that. What, when we're talking about this kind of how would you know if there's an issue with a loved one or a friend or a coworker? I mean, is there any highlights where we can sort of pick up on and go, maybe something's going on, maybe they need some help, maybe they're 1 of the 4 that need help? How can we tell?
I think you'll notice changes in their life. Are there things that they used to really enjoy doing, and now they really aren't getting out there doing those things anymore?
Social activities?
Social activities. Going out with anybody and just would rather stay home.
Right, and that's a big one. I mean, this is one of those other stats we talk about at Mental Health First Aid. Emmy, any of the other things? I mean, there's 3 things that we're looking at specifically. One was socialization.
Struggling with work, that maybe you're not being as productive anymore. Coworkers are maybe bringing things up that, you know, they feel like you're not completing your work on time, or just struggling to maybe understand the work that you normally would do very easily. And also maybe isolating from family. Just kind of avoiding, again, different situations, and just things in general that you didn't do.
So with family members?
Family members, and then with that, relationships, and kind of pulling away from relationships, not only social activities, but avoiding other people, and just doing things differently than you've done in the past.
Right. I mean, there's a lot of indicators to pick up on, and I think people don't, they're nervous about it. They don't know, well, what do I say? What do I do? I mean, how do I approach them? And I think that's one of the biggest things we get through our trainings, and we're talking to students and stuff, that they don't know how to approach them. And the other thing is, it's private. This is private. This is none of my business. I don't really want to talk to them about it, because I might be infringing on their information. What do you think of that?
Well, I think there are so many services out there to help, that if it's kept private, then there's so many things that are lost out on. And if you are worried about somebody, just talk to them. Talk to them. Try and take it out of the shadows. If it's a child or an adolescent, somebody who's in school, there's trained people at the school as well to help and try and access these services for them.
And I think that's important to say also, when we say work related, you know, there's
For
three
kids at
things,
school.
there's relationship, work, and social activities. Work is student. That's their job, and that's what we have to look at. And there are a lot of people there at the schools to help out and work out with them. We're looking at the colleges, same thing. I know a lot of people understand that middle school, you know, the lower grades and high school, that there's counselors there to help out and do different things. But colleges had the same thing. We were just at North Central, and we also do classes at NIU and Joliet Junior College. And at North Central, we were teaching clinicians, nurses, and other people, students who are hired by the school now to be the first responder types to help out and be in the trenches to know what's going on with the kids, the students. I guess I can't say kids, being college students and stuff, they're young adults as we go through. So there's lots of indicators that we can see. Any other indicators, Emmy, that you can, you know, a normal process? We're looking at 5 different things: anxiety, depression, psychosis, chemical dependency, and eating disorder. So there's, across all those, anything else you can think of that would be, besides our main ones we were just talking about?
I think it's just the biggest thing for me when someone is first starting to show signs of a mental illness is the changes that they have. Are they being secretive? Looking at eating disorders, are those daily patterns of eating changing? Are they not eating as much or hiding what they're doing? Do you feel like that person has become distant, and when you used to know a lot about them, you no longer do? That you feel like you've kind of lost connection with that person? But I think going back, just kind of asking them how they feel can be like the first thing to do if you maybe don't want to divulge into the details of what's going on, but that doesn't mean you can't approach them and say, you know, I've been noticing this, you know, if you need someone, I'm here. It doesn't mean you have to ask personal information about what's going on.
And laying a foundation down with that person, planting a seed, saying, hey, you know, I'm here for you if you need it. And it could be a huge beginning for it. And what we're trying to do is to explain to the audience here that there are so many different avenues, so many different things going on that we have to work with them. And I think also a big part of this is you've got to keep it pretty confidential. I mean, with the people, so you're not spreading, you know, saying, well, they're sad over there, you know, I think something's going on or something's happening, where you're giving that information out and you're going to lose credibility with that person. But there are certain incidences where we can't keep confidential.
Absolutely.
What are they?
That would be if you feel that somebody is a danger to themselves or somebody else.
Right, right. And if you feel they're going to be hurting themselves, you cannot keep that confidential.
No.
You got to be able to talk to somebody about it, and you got to be able to talk to them to get the idea that they need to go out and get some help for it. I think that's a very important part of it that we have to look at too. But the other big part of it is, I think that to get the information down to people to be comfortable with this and to be able to talk about it. I think that's one of our biggest things we have to look at. We're going to talk about, like I said earlier, what we're talking about this is to lay a foundation so people understand that 1 out of 4 of us could be having a problem. And we're going to talk about insurance and other things that involve and be prepared, how they prepare for these types of things. And we'll talk about that when we come back. We'll see you in a minute.
It begins innocently enough. You don't return a phone call. You break a date at the last minute. But in fact, it's the beginning of a pattern. And soon, your friend with mental illness realizes you're avoiding them. But what if you knew that your friendship was the key to their recovery? Would you still lock them out of your life?
Real men know that getting tested is the way to take care of their families. That's why real men wear gowns. For a list of the tests you need, go to ahrq.gov.
Welcome back to Mental Health First Aid. We're talking about navigating mental health services. It can be very complex and very hard to understand, but we need to understand these things because 1 out of 4 of us could have a mental health issue. And when I didn't say those people, I said us. And it's our family, it's our coworkers, it's our loved ones, and we have to be ready, prepared of how to handle these things. And we have with us Emmy and Cheryl talking about these different things, and both are clinicians, so you have a background with it, and both work for Linden Oaks. And what we're looking at now is that we built a little bit of foundation to understand why we need to be prepared and ready for this type of thing. How much time goes by before somebody will get help?
Sometimes it can be up to 10 years before somebody really will look to access help. They can be struggling for a long time.
So they'll be literally hurting for up to 10 years. And the quicker, I mean, as clinicians, the faster we can jump on this, the better we can help, the faster we can help them, right? And get through the problems and stuff and going through this. So what we're trying to do now is to understand, where do we go from here? We know, okay, there may be a possibility that we will need the help. What can we do to get ready for the crisis? What can we do to prepare for this now, or just to be ready for it? Or what do we need to do next?
Well, and I think it's important to look at to not wait those 10 years. That if you start noticing things along the way, look for the services that are out there to help when things aren't at the crisis level. If it has gone that long or less and it is at a crisis level, there are people out there. Your primary care physician can be a good place to start, as well as going to the hospitals to have an assessment done.
A lot of services. There's services, a lot of services out there. We've had a show on NAMI talking about the National Alliance for Mental Illness. We had Mary Dalton talking about that, and NAMI is just an awesome service to go out and get information on. So we always want to bring that up, that there's support groups out there and different things. Can you give me any other support groups?
Let me think. There are support groups out there for kids dealing with depression and anxiety, and different social skills groups.
Eating disorder support groups?
There are eating disorder support groups.
ANID, as well as chemical dependency with AA, NA.
Right, right. I mean, talking about chemical dependency, there's some real huge ones out there. What's Al-Anon? I always used to bring Al-Anon up with when I was at the police department, would help people when they have an issue with it, with a spouse or loved one who is an alcoholic or a drug user, and they couldn't get past it. And I says, you know what? You need to get your head on straight. Why don't you check out Al-Anon? Could you explain what Al-Anon is?
That is a wonderful support group for families. It helps them learn ways to cope with and deal with the stress that they feel in trying to help these loved ones. And there are support groups like that for other issues as well when it comes to family members dealing with depression or bipolar disorder. I think there's a support group for families dealing with kids with ADHD.
Right, right. I mean, you can find the groups, and the internet's out there where we can find, but we have to be careful with the internet also. I mean, because you can get some support groups that maybe not be the quite right for you or what's going on with it, and it's a trusted, and we have to be careful with that also. So I think starting with NAMI, with the AA groups, the different support groups, can we give information out like that at Linden Oaks?
Absolutely.
I mean, if you came in and asked, went to admissions, we could give information and give them support groups and different things. One thing I want to talk about before we get into admissions and talking about that procedure, because it can get sort of hard to understand, and we don't want to make it scary for people. We want to make it very simple. What support groups are probably the most important that a family, oops, I said one, that a person could have, you know, in the different support groups? What do you think? What would they be? I said family. So
Let's say, as you're alluding to, family.
Yeah. So I mean, family is a big one, right? Could any other religious aspects?
Absolutely. Churches can be a huge support group for people, you know, going outside of maybe your typical weekend friends and family. That a church group can be a very large
And you
support
said the
group.
other one too, friends. Yeah, friends are huge, and we need to find out what the support groups are that the person we're helping, and to find out what the support groups are and connect them and work together with them and go from there. We're talking about the procedures now, the procedure for an admissions type. And I'm not just talking, they're probably somewhat generalized, I would imagine. Now, what we can talk about professionally is what Linden Oaks procedures are. And I've got a feeling they're probably going to be pretty generalized as it goes across. And I know your background, Emmy, was part of that before you came into the utilization review. You were into the bringing people in and admissions and talking to them?
Yeah, I was actually a counselor in our intake department, so I would be someone that would do an assessment on anyone that would come in, determining if they needed services. And that can be, you know, anyone. We take anyone from the age 12 and up to the geriatric population with the multitude of issues that we've kind of talked about between depression, psychosis, eating disorder, chemical dependency, that a generalized assessment is done with anyone that comes in looking to get treatment at any level of care that we have.
So what's a general assessment?
A general assessment is something where you can come in and you can come in to get the assessment done in various ways. You can either call Linden Oaks, our intake department, and make an appointment. We schedule appointments throughout the day. I'm not exactly sure. The hours are kind of always changing as to when they have assessments scheduled, and
So
the
you wouldn't have
times
to
are
wait
available.
then?
Correct.
You know, if somebody's in
Yep.
front of you, then you'd make an appointment.
Correct. So if you make an appointment, that's your time to see a clinician, so you'd get in faster. We do operate as an emergency room as well, so you can walk in 24 hours a day. There's always someone in our intake department that would be able to see you if it was
24/7?
24/7. If it was an emergency situation. Or if you felt like you needed to call an ambulance or something else, you could always go to the Edward ER, where a clinician from Linden Oaks would also come over to see you there and complete the assessment in the ER, especially if you also needed medical treatment due to a suicide attempt or something else going on that you may need medical attention as well.
So any emergency rooms, I mean, you can go
You can
and
go
it's
to any
24/7 and
Yeah.
get the help, the admissions type
Absolutely.
thing, and to try to understand, they can get you the help from there. And I know with our mental health first aid, we teach a lot of emergency room nurses who really like the program because they can get a better foundation also to try to help the people and go from there. You said something, a magic age. What's the magic age at 12?
We just don't have programs for patients under the age of 12 at this time. We used to have a child unit, and they just didn't feel like the services were needed as much as the adolescent
We
population.
had so much more with
Yeah.
the other that we had to fill with that. But there are
Correct.
adolescent areas where they can
Yes.
go into and stuff, and we can arrange that for them.
Absolutely.
Same type of thing.
Yeah, so if it was a crisis situation and Edward was the closest place and say your child is 8, you could still bring them in, get an assessment, and we could help you find the most appropriate place for that child to go.
So they come in, they made their appointment, would they talk to somebody like you? Okay, and you would interview them and get information?
Yeah, what would happen is they'd come in. First, we'd take some general information. Someone from our business office would meet with you, get different insurance information, generalized phone numbers, address, just that basic information and paperwork. And then what would happen is a clinician would come in, such as myself, and talk about what's going on currently, what's been happening in the last 24 to 48 hours, up to the last week or two that made you come in for an assessment at this time.
Are they by themselves or can they come with somebody else?
You can come with someone else, and you can choose if you want that person to be in the room with you or not.
Oh, okay.
You can have them in the room for part of the assessment, and maybe a question comes up that you would like to talk to the clinician by yourself. We can ask that family member or friend to wait in our family room that's right down the hall, and they can come back in whenever the patient feels comfortable
So
again.
whatever they're comfortable with, and they want to have somebody with them, they can have somebody with them.
Absolutely.
And then that person who's with them can help and explain things too?
Yeah, we actually really appreciate getting family collateral and just information if the patient is willing to let us talk to mom or dad or a friend, husband, wife, if they have any other input. Maybe that the patient doesn't know that they were struggling in different areas or doesn't remember certain things that have happened depending upon the state of mind that they're in. So
Right.
getting additional information is always helpful to help the person as best as possible.
Very interesting. I tell you what, when we come back, we're going to talk more about this, about the procedure, and what exactly happens after that, if they're brought into there, or what happens from that procedure. And we'll be back in just a minute. We'll see you then.
The first step to getting into college is finding someone who can help. For the next steps, go to knowhowtogo.org.
Everyone has friends. There's online friends, friends to go out with on a Saturday night, friends to hang out with and do nothing, friends who show up on moving day. And then there are the friends who'll be there if someone is dealing with a mental illness. Are you one of those friends?
Welcome back to Mental Health First Aid. We're talking about how to navigate mental health services. It can be complex, but we're trying to break those barriers down right now and discuss them and figure out how we can get through them. And probably a big part of it is knowing your insurance, knowing your information, knowing your support groups, and knowing how to help the person. It can be very simple. And we're looking at it right now. We want to go a little bit further. I mean, when we were discussing about admissions and the procedure and the intake type thing, you were at the point where you said you interview them. You could have somebody with them. They could have if they'd like, or not, whatever they're comfortable with. If a 13-year-old came in, would they be able to? Would they have to have a parent with them, or could you interview separately, or?
They could always come in by themselves, but to be signed in and to legally be admitted, we would need parent consent. Being 13, we'd have to call the parents, let them know where they are. But that doesn't mean that their information is not confidential.
If a parent brought them in, would the parent have to be there with them during the interview?
No.
Okay.
No, if the child chose to talk to the clinician by themselves, they could do that.
If the parent says, no, I've got to be here, I'm going to be here.
That'd be something we'd work out on an individual basis. We would allow,
Negotiations time.
yes, it would be negotiations time. We would allow the parent to talk to the clinician as well, whether they wanted to do it by themselves or with the child present. That we do a lot of kind of bouncing people in and out of the room to get the most information that we possibly can.
So we're at that point where the interview is done, you assessed, where do they go from there? Do they go into Linden Oaks right then? Is there an outpatient, inpatient? How do you decide all these things?
There are all different levels of care, and after going through that assessment, kind of figuring out what's going on with the person, what that clinician would do that's been meeting with you would speak to a psychiatrist. The psychiatrist is not necessarily in the building. We wouldn't be talking face to face, but we would get in touch with the psychiatrist, kind of go over the clinical, what's being talked about, what the patient is struggling with, and the doctor would make a decision at that point as to what level of care they felt that patient needed. And that can vary from an inpatient level of care where they would stay in the hospital, or a partial level of care, which is a full day program, but they would go home at night. An IOP level of care, which is half-day programming.
What's IOP?
IOP is intensive outpatient.
Okay.
So it still often meets with the partial patients, but it'll be more like 3 to 4 hours a day versus a full day of programming that the partial is. They'd still meet with a psychiatrist, have a therapist, groups, things like that. Or we may recommend that the patients see an outpatient psychiatrist or a therapist.
So there's lots of different avenues they could go in, and you're pretty much assessing that, but you're giving the information to the psychiatrist to come up with the final answer.
Correct.
Of what would be done and what's happening from there. So we must have a lot of psychiatrists.
We do have a lot of psychiatrists that they take turns being on call and
Being
on
woken up
call
in the middle of the night.
24/7 because you got to get a call and go from there. So you're pretty much got an idea what they're looking for.
Absolutely.
And what answers are going to, or what questions they're going to have that you can answer. What happens if they do come up with a question that you can just go talk to them again then, right? Just say, we have this other question that we're looking for, and you can get that information and give it to them to make the decision.
Absolutely.
Yeah, so it's not as hard of a thing to go through as it sounds like.
No.
Will you know this whole procedure? Hour, 2, 3?
Depending upon the level of care, if it involves an admission, we usually like to get people admitted within an hour and a half to 2 hours from the start of meeting with the business office to being back on the unit in the room meeting the nurse.
Right, right. And being going through the procedure, going through. And if it's an outpatient, you'll give them all the information, explain to them where you got to go, what's happening. And
Yeah, we'll set you up with schedules, maps as to where to go, times, who your doctor will be, phone numbers that you need to reach us, all your paperwork that you signed you would have copies of so you can take it home and look through it.
have you ever had a patient where they came in and discussed it and said, a couple of support groups, you talk to the psychiatrist, and a couple of support groups would probably be really good for you.
Absolutely,
And that would
all the
be,
time.
and so you won't have to go that far, or whatever you think it is. A support group would be very simple to do, and just to help them through it. So that'd be
Again,
something.
don't wait the 10 years.
Right, right, because that's really hard to go through.
Yeah.
We talked about also insurance. Not that it's evil or terrible or anything. It's something that's a necessity to have.
It is.
That we need. How can you? I mean, we get these policies. What are you looking for? To see if your insurance is what you need, or if you need to have more, or if you feel that you're not adequate until you find out the last minute. You go, oh,
Yeah.
I don't have this, or We mentioned about days, about
Yeah.
how many days. I mean, being in the same office area with you, with your group, I constantly hear you discussing it with other doctors, other insurance companies, to negotiate how much time they can have. But a lot of that is dictated by the insurance companies, right?
There's guidelines set by that we know, and that's what we base our judgments on, the criteria on. It's been decided as a whole and as a mental health community what level of care people need with certain symptoms.
If your insurance says you have 3 days, that's all your insurance covers. Are they sorry, you got to go now? Or do you work with them and say, okay, we'll work on a payment plan or something, or whatever,
Yes,
you know,
we
to
would
get you the help?
absolutely work on a payment plan. You know, our number one goal is patient safety,
Right.
and we would take care of patients first, regardless of insurance.
Right, and try to get them through and take care of it. And you said there is a big differences between insurance, being that there is 3 days to undetermined amount of days.
Yeah, looking at every policy is very different as to what your coverage entails, how much of a deductible you have, how much each visit is covered, whether it's covered at 50% or 100%. Every policy can be extremely different. So when
It's hard to explain each thing or what's going on.
as we were talking earlier, preparing for a mental health crisis, knowing that policy just as you would know
Basics.
medical coverage, you know,
Right.
is a general physical covered, is a dental exam covered, knowing what your mental health coverage is as well can be very beneficial. So when you're in that time of crisis, that's not a question.
Some of the language that we use, I mean, every profession has different languages, and insurance is no different. And clinicians and insurance sort of have meld together a little bit with the language because you understand the language. Medical necessity, what does that mean?
Medical necessity means to meet criteria for a certain level of care.
Where does that come from? I mean, is there some grand book that says, okay, we need to follow these things? What is the what we go through?
Actually, there are whole books of the criteria.
And for clinicians, there's books also. What's
Yes.
that one book that I'm talking about?
The DSM.
Oh, yes, the DSM. Sorry, I'm thinking insurance books.
No, yeah, I got
Yes.
you on the other side.
Yes.
But the DSM gives us the criteria exactly, boom,
Yes.
boom, 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 of what, if it's depression, if it's anxiety, if it's this, and that's what your psychiatrists are going through, right? That's the book.
Yes.
And that's what the insurance companies have to go with, that book. You have to go with that book. And it's sort of the tool that ties everything together.
Yes, and then when there is that diagnosis, then the insurance companies have their manuals of what meets different levels of care.
Right.
You can have depression, but does it meet an inpatient level of care, or is it more
Right.
suited for outpatient therapy? And that's where the entire treatment team is looking at where is this patient within all of that criteria and what medically meets their needs.
And the biggest thing I can think of with that whole thing, it reminds me of law books. You can interpret, and you know
all
what you
subject to
think it is, what they
interpretation.
think it is, and that's the negotiation time. They try to work out best for the
Yes,
person.
and
Yeah.
that's what we do. We try and negotiate that with the insurance company
Right.
along the way. And when someone is admitted to any of the programs, there is somebody who will contact that insurance company in the beginning,
Right.
and they'll be given an initial amount of time, whether it be 3 days, 5 days. And once that time is up, that doesn't mean that that's it.
Right.
That means that it's our time to negotiate again.
Right.
So if a patient gets a letter in the mail, which happens all the time, that says this is what you were approved for, that doesn't mean that that's
And
all.
then they can, the insurance company's there to help too. They
Yes.
don't, they want to make sure that person's getting the help because there's liability issues with it. Yeah.
Yes.
We could do a whole class just on that, a whole session just on DSM. And I tell you what, maybe we will when we come up. But we're really glad that you showed up today and watched the program, and thank you for being here, Cheryl Lemme. We appreciate that. And thank you for being here. And we will see you next time at Mental Health First Aid. Thanks.